So you've been referred to see a board-certified urogynecologist, and you don't know what to expect. Dr. Stephen Tugbiyele here, board-certified urogynecologist, and I want to describe in this video exactly what to expect when you go to see a fellowship-trained urogynecologist, either for pelvic organ prolapse, that vaginal bulge, or bladder leakage. These are conditions that affect millions of women each year, and so seeing a board-certified urogynecologist is key to getting you better. And so initially when patients come to see me in my office, initially you'll be met by my friendly front desk staff, and they'll get your demographic information, contact information, insurance information, those kinds of things. And then afterwards, you're brought back by my friendly medical assistant who will then get your vitals. And after that, you'll be asked to use the restroom to give us a urine sample and also to empty your bladder completely. After that, you'll be brought into your examination room. And then my medical assistant will then check what we call a post-void residual. This is where we actually do an ultrasound and we place of the lower abdomen, similar where the bladder is, in order to determine how much urine is left in the bladder. That gives us an impression as to how well you emptied your bladder. Afterwards, you then see me, and I'll typically introduce myself as a board-certified, fellowship-trained urogynecologist. We have care for thousands of women like you, week in, week out, with this very bothersome condition. It affects many, many women. So I reassure my patients that you're not alone. There are good options, solutions that are safe and effective to get you better. And so I like to typically listen to see how this is affecting you and see how we can get you better. And so I review with you your medical history, and also after that, get to know you. Typically, I like to know, things that you enjoy. Typically, whether it's kids or grandkids, work, life, school, business, in that sense. After that, I typically step out of the room, and then you would get on dressed from the waist below only, typically. And then I come back in the room with my medical assistant, chaperone during the exam. I'll do an abdominal exam, and then I'll then do a pelvic exam. Now, during that pelvic exam, check for a number of things to see how supported your pelvic floor is. I look at the support for the bladder, for the uterus, for women who've had a hysterectomy, the top of the vagina or the vaginal cuff, we call it, the cervix in women who still have their uterus, the posterior vaginal wall, where the rectum is supported. I look to see the tissues on the outside, the labia, the clitoris. I look at all these areas, examine them thoroughly, and usually I'll then have you cough into some tissues. And the reason why is because it's a pretend cough, I like to say. And so when you cough into tissues, then that kind of helps you give us a very strong cough. And the reason for that is a number of ways, a number of things, to see how well supported your pelvic floor muscles are. It also helps me see how supported your bladder, pelvic floor, and the organs are. And that added force of the cough helps me see how well supported they are. Then I see if there's any leakage that happens when you cough. And I also do what I call a POP-Q exam, again, checking and measuring all the areas of the pelvic floor to determine if there's prolapse, and if there is, to what degree that prolapse is. And if it's indicated, then a rectal exam. And then afterwards, typically we'll talk about all the examination findings, what effective solutions are, options are for you. And those options can range from whether it's behavioral changes, dietary changes, lifestyle changes, essentially, or it could be pelvic floor muscle exercises. Usually I counsel my patients 100 Kegels a day keeps the urogynecologist away. So it could be just doing those Kegel exercises are going to really be helpful. Or it could be pelvic floor muscle physical therapy, and that a referral will be made to a physical therapist. Discussion could also involve pessaries and how those could be helpful. Or it can involve surgery. And for surgery, it could either a vaginal surgery, a laparoscopic surgery, or robotic surgery. We talk about the pros and cons of all these options, and then together devise a plan of action. And all the while I'm listening, seeing how this condition has affected you, and seeing what how it's affected your quality of life, what your goals are, and then together formulating a plan that meets your needs and your goals, and gets you better and improves your quality of life. So that essentially rounds out the visit. I usually will answer all your questions thoroughly, get literature, make reference to some online educational resources, including my YouTube channel that you're listening to, and leave ample time to listen to questions and answer them thoroughly. And if there's depending on the next plan, then that will dictate what the follow-up visit and follow-up plan is. And so that essentially that describes a urogynecology visit, especially for patients who are coming to see me. I'm very thorough. I like to listen, understand how this is affecting you, devise and having us together come up with a plan that will get you better and improve your quality of life. This is something that you didn't cause. It's a very common condition that affects many, many women who've had children, women who, as they get older or through menopause, different other risk factors can really impact the woman's pelvic floor and lead to conditions that affect the woman's pelvic floor. And so I tell my patients that you don't have to live or put up with it. There are good options that are safe and effective to get this better. I like to listen, and I warn my patients before each step of the exam so there are no surprises, and then work on getting a plan that will improve your quality of life. And so I've cared for thousands of women each year with this very condition safely, effectively, and I'm very happy for the reviews that patients have left online as to how much better they feel after they've worked with me. And so this is something that you can share with a family member or share with someone you know who needs this. Please do share. A lot of women have this condition, live with it, put up with it, don't have to. So please share this video. And for anyone who's looking to see a board-certified urogynecologist who will listen and has expertise, and will take care of them. I'm a Atlanta top doctor of 4 years and counting. And the way you can work with me is by visiting my website. That's www.drtugbiyele.com. You don't have to memorize it. It'll be in the description. And that will take you to my website where there's an inquiry form that can be filled out. My office number is 470-325-1280. And I look forward to working with you, getting you better. Imagine how you'd feel once you no longer have to deal with whether it's a vaginal bulge or bladder leakage, or the things that all the other things that can come with a vaginal bulge or bladder leakage, like recurrent bladder infections, for intercourse, pelvic pain, difficulty with bowel movements, constipation. All sorts of things can affect a woman's pelvic floor. You don't have to live with it. They're good, safe solutions and options. And seeing a board-certified urogynecologist like myself, top doctor in Atlanta, is the way to get you better. And I'll see you in the next video.